It is Friday, May 22nd. Welcome to today's daily task force update, COVID-19 task force update. On the program today, Lisa Westaway will be here. There's a lot of new developments, Cattery Memorial Hospital Center and beyond. Of course, Lloyd Phillips will be here. This being Friday, he'll tell us about the week that was. But we'd like to start things off today with some news that came from the Kahnawake Fire Brigade. With the beautiful weather that we've been having, and we don't want to complain about it because it is beautiful, but it has caused conditions that are very dry. So telling us about some concerns is the Assistant Chief of the Kahnawake Fire Brigade, Bryan. We'd like to welcome him in for the first time on this program. Bryan, it's all yours.
Sego, what kun horados o aguego, agurão de new jets. Negadi no ani wani zerade, ne wagere the geri hoana te giga no hoda de guaniku harigo Canada go tanu nene ruswatage. Negadi giga sozi ostat nene atste tanu yatte yuduris. De guaniku harezi no ayodege. Tanu go Kahnawake tanu jawarodo nene oni. Negadi ne di kwatu hunzoni as wada ni gora ti doga so wada gatu doga so wat huni atste goni wa ajiniti so wat huni ya so ti de goano negadi ya tadi kwatu hunzoni aga nyaga ne dano ayoda ge oskawa go ne di de wari wanuta tano doga so wada ega de kwatu hunzoni ne doga awado se horo ge dosa aga nyaga ne tano akta as hawa ge Isa awado na hoda an sarswate toga ohneganos ohmroda yomsawe ne an sarswate dosa ganyago ne ti soti ostata saha jawarodo ne di kwani guhare ne di kwata hunzoni skat ne agwe ganada go do wayota ne ti yata ni ta di kwata hunzoni ne ruswata tono kwadi ni hune ne onokti hoda yota swate giga ne ti Toga taina ganaga gonusa o yodege. So ti an dawa Wihse haye. Toga ni yatta gaya zini hadi ruswata awado yakia dege na ne. So I'd like to announce the concerns that we have from the fire department, because in the region, SOPFU, the agency that monitors all the forestry around in the surrounding area has issued an extreme burn hazard for all fires, for all forest fires in the area, because it's so dry. It's been so, like Joe had mentioned earlier, the weather is great. It's really beautiful out. There hasn't been much precipitation, not a lot of rain, and it's very dry. The humidity is really low. These are ideal conditions to have forest fires, and there are a number of them already burning within the province and within the area. We don't want that to happen here. So also the fire brigade does not want to issue a total fire ban. We understand that what's going on within the community, the lockdown, everybody is using having small bonfires as a way to de-stress and relax and feel good. And so we don't want to have a total fire ban. We request that everybody cooperate and have small fires, small bonfires in a contained unit with a spark arrestor if possible. And if everybody can actually get that in the future, that makes our job a lot easier. We do not want to be out there fighting grass fires and brush fires, because in case somebody has a house fire at the same time, our resources are already dedicated, or they're already tired and they can't go help and take care of the community the way that we should. This is particularly for Jawarodo. Spark arresters for sure to be used in Jawarodo because of the nature of the territory. It's really heavy forested, and if a fire starts over there, it's going to be catastrophic. because there's limited fire suppression services over there. It's really dangerous for our community. So nedi kwado hunzoni the wari wanundu agwes katna the wayo the skono ziniti wadu the wado hets the giga. Neti giga no hoda gahrahrinest ya ne saga tamtu the wado wayagon awang anakti skatna the wayo the skono ziniti giga the wado hets the zino hoda giga I waneg nuwa ni guanata. Now.
Now, Bryan, and as you mentioned, that a lot of people are using fires, little bonfires. It's therapeutic because when you're locked away and you can't do this, you can't do that, people are still at least able to do that. And but it is a situation that we need to be careful of. And if you are having a little fire in your backyard, do it safely. And in order to illustrate that a little better, we spoke to the lieutenant from the Kahnawake Fire Brigade, Wihse, Stacey. He'll give us a little demonstration on how to keep your little fire safe.
Thank you, Joe. With everything that's going on these days, I understand that a lot of people are getting outside. They want to enjoy the outdoors, especially at night. A lot of people are enjoying fires. They want to a lot of people, it's therapeutic, it's enjoyable, it's relaxing, and it's one of the only times where people can actually get together, gather amongst their own household. So with everything that's going on, we want to make sure that you're doing this safely. So what we're going to do now is show you how to have as safe a bonfire as possible. So first off, in front of me is a lit fire with a approved fire pit. Okay, this is important because it will actually contain the fire and it won't spread out to the rest of the grass. As you can see behind me, the grass is all green. Okay, the likelihood of something like this spreading in the grass is not very good. However, it's very important to remember embers. So when you have a bonfire going, it's important to have a spark arrestor. Okay, this screen is exactly for that. It'll stop the embers from traveling up into the air and possibly starting the grass behind me, the trees. There's a nice pine tree behind me. Okay, things like that can spread fire very quickly. So it's very simple. You just slide it over. And that's it, that's good, okay? You want to make sure as well you have multiple things around you to protect it in case the grass or even some people happen to catch fire, okay? You obviously don't want that, so you want to be safe and prepared. So you can have your basic household fire extinguisher. This is an ABC 2.5 pound extinguisher. There's nothing special about this, and you can find it at almost any hardware store or pretty much any store that sells stuff like this, okay? You could also have a watering can, very simple. At the end of the night when you're done, just pour a little bit of water on it, okay, and it'll shut it out. If you have a garden hose at home, not everybody does, but most people do, just every now and then spray around it, okay? I have my lovely assistant here, he's gonna help me out. He's gonna spray around the grass. This isn't gonna shut out your fire, but what it will do is keep all the grass around it wet so that it can't burn in case the embers do get just outside of it. One of the most important things ever, never leave a fire unattended. In times like today where the fire danger level is at extreme, anything can burn and it can burn fast. There hasn't been any rain in a while. We don't expect any rain to come for a few more days at least, okay? So when you're done, you want to make sure that this fire is out. Don't stop because, okay, somebody forgot marshmallows, you want to run back in the house. Okay, please don't. You don't know what can happen in the meantime. But especially at the end of the night, you want to make sure that the fire is out. You want to take your garden hose, you want to take your watering can or your fire extinguisher, and you want to soak it down as best you can. Even when that's done, take another stick around somewhere, stir it up a little bit, spray a little bit more. Okay, so my assistant helped out. The screen arrestor now is cool, so I can grab it. Okay, it's not hot. Now I'm just going to take a quick stick. I'm going to spray it, stir it around a little bit. Okay, and we're going to spray it again. All right, everybody who's out there, please make sure you're being as safe as you possibly can when you have these fires, okay? We're not going to stop you and say no, but please, please, please be safe. Be mindful of what you're doing. Keep your fires small, and while you're out there, stay safe. Thank you.
Nice job, Wihse. Even I could understand it now. We'd like to bring on Lisa Westaway. She's the Executive Director at the Kahnawake Memorial Hospital Center, and she has plenty to update us on this Friday afternoon. Lisa?
Good afternoon. So I do have a few updates regarding Kahnawake Memorial Hospital Center, and then a few messages to give to you that are a bit of a repetition from this morning, but important messages. So firstly, for KMHC, something new that is happening over the next week or 2 weeks is a screening of asymptomatic employees in our long-term care facilities. So that's our long-term care, short-term care, all of inpatient employees are presently being screened. So this is a new directive across the province for all long-term care employees, and it's a way to get a baseline regarding this asymptomatic situation for the Minister of Health, and it's a good opportunity for us as well to see what the impact of asymptomatic transmission of the virus is or can be. So that is happening over the next 2 weeks. It's only at KMHC. There may be some new directives coming for other areas, for example at T-Bell. For the present time, it's really only long-term care facilities, and we are not making any changes to this directive, and the major reason for that is with respect to the availability of testing materials and resources. And so if we were to test more than the 48,000 people that Quebec is presently testing in long-term care facilities, we are very likely to see very long results, waiting for very long for results, and this will have an impact on those possible tests for people who do have symptoms. So we need to follow the order that is being put in place by the Quebec government simply because of the availability of testing. Also, once we test our long-term care, we'll get a better idea of what the situation is and what the percentage of asymptomatic carriers can be, and we'll be able to make decisions about that moving forward as well. So these employees are being tested at our testing site, and they're going through, I think we've tested I think about 30 people up till now, so this is going to continue over the next 2 weeks, and anybody who receives a positive result, no matter whether they're contagious or not contagious, they will be self-isolating as well. So I'll keep you posted on that situation. There's also a new change that has come into place recently regarding masks. So we know that we see a lot promoted that we should be wearing masks when we cannot maintain the 2-meter distance, one person to the other. And so this is really prevalent in Montreal, for example, for people who are starting work on Monday, who may be taking the metro, the bus, who may be in a work environment that does not allow them to social distance. And so the recommendation by Quebec is that people who cannot maintain the 2-meter distance wear a face covering or a cloth mask. And so in line with that, there's new directives as well for KMHC and for KSCS for patients who are coming into our buildings. So really just to clarify, it's for any person who is coming into KMHC who does not have symptoms, so is asymptomatic. Any person who's going into the KSCS building who does not have symptoms should be and will be asked to wear a cloth mask at all times. Children under the age of 2, anybody who has trouble breathing, has a disability, or is unable to remove the mask by themselves without assistance should not wear a mask, because this is a risk for them, and if you already are someone who has trouble breathing, you don't want to wear a mask because this could be a risk for other issues. So again, I'm just going to repeat that. Any patient who does not have symptoms will be required to wear a mask when they enter into KMHC or when they enter into KSCS, and it's only the patients, it's not the employees. And they will have to wear a face covering or a cloth mask. They will not be given a procedure mask from the hospital. The procedure masks are kept for our employees or for patients who have symptoms. So if you have symptoms, and when you're triaged, when you come into the building, that's when you would get a procedure mask. So there's a very big difference between the two masks. One, a patient who does not have symptoms will have to have that mask on their own and wear it into the building, whereas somebody who has symptoms will be given a mask when they come in if they're allowed entry for certain situations. So we have not put this in place yet. In fact, I'm giving you the information before I distribute it to all of the staff. So this will be implemented next week, but I would like to give you the opportunity to prepare for this, because if you're coming into the building, again, you'll need a face covering or a cloth mask. And so this will allow you to prepare, and early next week, I'll let you know. It'll come into effect probably on Tuesday, so you can prepare for that date. I also wanted to bring some information. We have many families who have been contacting us, because usually at this time of year, families will bring in summer clothing for residents at KMHC. And so we've decided to organize a drop-off day, a little bit like we did on Mother's Day. And we didn't want to wait till Father's Day to do this. So we've set up, we're organizing a drop-off day on May 31st for family members to be able to bring summer clothes into the to us for their family members at KMHC at inpatient. So there are a few directives that I need to provide to you, and this memo is already on our Facebook page, so you can go back to it at a later date. But it is really just for clothing, so just summer clothing. It has to be placed in a tied up plastic bag. All the tags have to be removed, and every single clothing item has to be labeled indicating the resident's name. We're going to again use the drive-through testing site, so that's, you'll be coming through in your car. We're asking that you do not come out of your car, and it'll be May 31st from 12 to 2 at the testing site, and it's for families who require summer clothing. We are going to have people picking up, and we're going to be washing all the items of clothing, making sure that they're safe before we distribute them to your loved ones. So that's again May 31st from 12 to 2 at the testing site at KMHC to drop off clothing for your family members. So that's the updates that I have for KMHC. I wanted to talk a little bit about what we're seeing a lot of lately is a lot of discussion and debate about measures that Legault has implemented recently about minimize or increasing contacts, I'll say, increasing contacts, because that's the way the media is portraying Legault's changes, meaning him allowing 3 different families, up to 10 people, to meet in a backyard or to meet in public spaces, and he's also as long as those families maintain social distancing. This is something new that was brought forth a few days ago by Legault, and we have a lot of debate in Kahnawake about this measure and what we should be doing here. So we clarified this morning, but it's such an important message, and we're hearing the debate over and over again that we feel that we need to repeat. So we just want to clarify again and bring back some data and some science that we've spoken about here at Facebook Live. So firstly, the main message that we want to give you today is that in order for us to reopen business, in order for us to move towards a new normal, for the next year, until there's a vaccine, social distancing will be the main criteria that will ensure that we are safe and healthy. Social distancing is the one major criteria. So we talked about infection prevention control, hand washing, very important, all the adaptations that the businesses are going to put in place, equally important. But if we don't social distance when we move towards these phases of reopening, what INSPQ has estimated is that there will be an increase up to 150 deaths per day. So this morning I said per month, and that was a mistake. When I re-listened, I realized I made a mistake. 150 deaths per day by July. And so if just by removing that simple aspect of social distancing, we increase drastically the amount of death, possibility of death. So first off, that is of utmost importance. So I want to go back to Legault's decision to increase those social contacts and really to clarify a little bit about why he's making this decision. So one main reason is that 911 has been inundated with phone calls, and 911 is unable, because they keep getting phone calls of people complaining of gatherings happening around them in homes next door to them. They're unable to respond to real emergencies. And so Legault has made a decision to stop policing the gatherings. And by doing so, he's put these measures in place, which in fact are measures that still respect social distancing strategies. However, he's putting more responsibility on the community and the population to make those decisions for themselves. So the gathering of the families still requires social distancing. There's still nobody who's allowed in the house. And again, he's banking on the population's respect of the social distancing guideline to ensure that there's not going to be an increase of virus transmission as he reopens business and the economy on Monday. So at our task force, we are still having these debates. We are still looking at the pros and cons, and we can today, all we can say to you is that social distancing is of utmost importance, and because of that, we are still maintaining our request that we continue to respect that. We know, and we see it, we're not blind to this, we see it everywhere, that you know, we're really on a scale here of people who are no longer respecting social distancing, who are continuing to gather, and then the other extreme where we're respecting the social distancing criteria 100% of the time. Of course, we spoke about this morning, and we've mentioned it often, that at some point there is an importance in every person taking responsibility for themselves, for the safety of their family. All of us, almost all of us, have either an elder living with us or an elder, someone over 60 or over 70 that we're very close to, and every decision that we make as an individual could have an impact on those people or on somebody who's immunosuppressed. So every decision we make should be made with the idea of social distancing in mind. That's the main message that I wanted to give to you today. We're going to continue to have these debates, but we're not ready to make a decision as Legault has done as of today. And we felt it important just to remind you of that one main criteria that will make a huge difference in the amount of cases that we have in our community and in the amount of death that we could potentially face in the future. So, thank you.
All right, thanks so much, Lisa. And just a couple of notes from what Lisa was saying. She mentioned that May 31st will be the date. That is a Sunday, and it's a week. It's about 10 days from now, so you have time to get organized for that. Also, mentioning about the masks going into the KMHC or KSCS, don't forget to put the mask over your nose, not just over your mouth. So as we get closer, of course, there'll be more information on that. There's been plenty already. So joining us now, it's been a short week, but doesn't mean there was any less work. Giving us his weekly update is Lloyd Phillips, the Commissioner of Public Safety.
Thank you, Joe. Kahnawake. Beautiful day, beautiful week in terms of the weather. Weekend is looking great, so wishing you all the best for the upcoming weekend. But what I'll start off by talking about is a concern that because the weather is nice, you know, obviously a lot of people are going to want to get outside and enjoy the weather, which we certainly encourage people to do. But again, as Lisa mentioned, we want to make sure that physical distancing and social distancing remains. And one of the areas of concern and the peacekeepers have received several calls already regarding the quarry. Large amounts of young people primarily going there, congregating in groups, enjoying, and I guess trying to enjoy the weather. But at the same time, it's an area that, it's an activity that it's nearly impossible to social distance. And the peacekeepers have been called there many times to go there. They kind of separate themselves for a few minutes, but as soon as they leave, they're back together. So I would ask the people to please, remember, refrain from the social contact, and younger people especially. It may not impact you very directly, but just think about your parents, your grandparents who may get the virus, and it could be very deadly to our elders. So keep that in mind when you're going out and doing these things around the quarry. I would even go as far as say even try to refrain from there as much as you possibly can. And the peacekeepers are going to be vigilant. They are going to be around there, but you can't be someplace constantly 24/7, so to speak. So again, just keep that in mind. And it all comes down to the key word I've been saying all week about responsibility, which we all do have as individuals. Also, I just want to update on a couple of topics that we discussed this week. Obviously, the big discussion was in and around the planned opening of the businesses. Listening to what the business people are saying, and a lot of them are again positive feedback. And in terms of getting their business ready, I had to clarify a few points. Inspectors are out there doing an excellent job, and there's great cooperation. So I'm confident, when the green light is given, that we'll have a very successful opening. As long as we have that cooperation maintains the way it's going. This week as well, as you may have heard, the state of emergency for the community has been extended until June 21st. So that keeps the mandate of the task force intact. It keeps us operating under the same rules that we've been operating since March. So that has been extended again until June 21st. And at that point, as we approach June 21st, obviously we'll keep reassessing where we are as a community, what's happening around Kahnawake, and see if there's going to be a need to modify that, or do we have to look at another extension. But we'll take that day by day, week by week. But it was determined, given the current state that we are in, that the state of emergency had to be extended for another 30-day period. We also had a couple of issues that we addressed regarding some of the, I guess we'll call it interference from Quebec, with different ministries, dealing with daycares and step-by-step, when they're trying to impose some of their rules on our local establishments, which again is not going to be the case in terms of openings or closures in the community. That's going to be with the Kahnawake COVID task force, and as well as politically, that the council is taking care of the issues with government in terms of there is agreements on childcare that exist in the community. Again, make sure that they back off and understand that that Kahnawake is not part of their jurisdiction. And so we've been dealing with some of the smaller issues like that throughout the pandemic, where again Quebec tries to impose what they think is right, for everybody. And that may work for their population, but it certainly doesn't always work for ours. And that's like some of the main concerns. We talked about, Lisa talked about a little bit, because Quebec is moving at its own pace, and changing some of the rules of the game, so to speak, regarding distancing and about gathering. Even though they're still saying social distancing is key, but no, they're saying, well, now let's make it, where you can group up to 10 people and such. That may be fine, for them. They're moving at their own pace. But in Kahnawake, we feel that we could be more conservative. Let's see what's happening within Quebec. Let's see how well that goes, for them over the next few days, next week or so, on how much social distancing actually is taking place and what are the impacts from that decision. And then we can learn from that as a community as well. That's one good, I guess, tradition we have in our community. Our people were always very wise to the fact of let's watch what other people are doing and allow them to make some of the mistakes. And then we could certainly do our best to avoid those mistakes as much as we possibly can. Bottom line there is, Quebec wants to move along on a path that they feel comfortable with, but they have a lot of other driving factors that such as economic and such that is pushing them forward. We have those same concerns in Kahnawake, and have been voiced very clearly by our many community members who are not involved in business. But we said from day one that the health and the science will always lead the way in decisions that we make on behalf of Kahnawake. We also looked at some of the other areas of daycare and we know with business scheduled to be reopening, and things start to progress. Obviously, people have young children. How many people have their grandparents or parents who are the caregivers or the babysitters, and now a lot of times that's not going to be something that is doable at this point. So looking towards the youth center and also step by step on how they could go about assisting individuals in that case. So there's some work happening on there, but mind you, there are limitations on what they can do, because as well, even within those two organizations, they have to make sure that the children and the staff are safe, and you have to obviously maintain that physical distancing as much as they possibly can. And obviously, you can imagine with young children, it could be very difficult. One thing we also noticed over the past week is really, I guess, some of the I guess frustrations of the community. We all been in this lockdown mode for some time, and everybody's feeling anxious. Everybody's feeling frustration. And I mentioned during the week as well. You can see some of the frustration coming out on people at work. Who are getting on each other's nerves. Much easier than they probably should. We see some comments on Facebook. Which creates a I guess a frenzy, for lack of a better term, like the one post that was out there that I'm sure many people have seen by now, when there was a post about the hospital and the Moochie's music, and that he wasn't able to perform out there, and then the comments started afterwards, and it was focused on the task force. And there was like a lot of negative comments about the task force, making these decisions and doing certain things, and that was not even that wasn't even a task force discussion. It was never brought here for a discussion. So I say that out there because it's certainly we're here doing our best on behalf of the community. So just because somebody posts something on Facebook, as we all know, we say this all the time, right? Just because it's on Facebook, it doesn't make it true. So something like that, we feel the repercussions of that, here at the task force, especially when we all know the people sitting around the table here are here, all the best intentions, for our entire community. We spent a lot of time this week also, fielding questions and comments from community members on the next steps. They want to know what's our community going to look like, after June 1st, if businesses will be open, and they're concerned for their personal safety, if there's more interactions, with the outside and so on. So, we spent a lot of time, reassuring people that, again, we're looking at the science behind all this, what is the actual risk by doing certain things, and we're going to be having more information coming to on that next week, where we're going to lay out much more detailed information. But again, sometimes there's a perception of a danger versus the reality of a danger, and we're going to try to work and explain as best we can on some of the I guess some of the realities behind that. I guess moving forward in terms of the task force and these updates, and I'm sure some of you people are tired of seeing my face and Lisa, and maybe even Joe, but as you may have noticed over this week, yesterday we had Dwayne Zachary, and we had Arnold Lazar, and then today we had Bryan Deere, Assistant Fire Chief, here on behalf of David Scott. Well, we want to try to bring more variety, of people who are either affiliated with the task force or even this community members as a whole to come in and give some of their perspectives on how they see things and how this pandemic is impacting them. You've seen last week there was 2 elders that were interviewed, and those are some of the more things that we want to bring that to you more, because there's always not the big news that we come here to announce, so we want to try to bring a little more variety to the show, and that way people will be more in tune to continue watching, because we notice there is some lessening of viewership on this. So I think if we bring a little new flair and a little more variety, that people will want to tune in even more. And and we've seen some of the stuff with Dega Lazar. Is actually some entertaining stuff that he puts together, and so we're going to look at that moving forward as well. So no, it's been a short week, as Joe had mentioned, but it certainly was no less of no. You have to cram 4 days, 5 days of work into 4 days, and so I think everybody is a little bit tired. And we're looking forward to a weekend where we could go home and recharge our batteries. I think the whole community could use a little bit of a recharge. So with that, Kahnawake, I thank you again for the overwhelming support and the message of goodwill you sent towards the task force that we heard throughout the week. Despite some of the negativity, we also received plenty of positive comments, and I truly do appreciate that. And with that, have a great, safe weekend, and I'll see you again soon. Onigawahe.